Music system is amazing. Music system is amazing.
हैकेथॉन का कल लिंक भेजा है मैंने। Hello, hi, sir. How are you?
Hey, good evening, Kenji. How are you?
Good, good, sir. Nice to see you.
All the best. This is a wonderful event which you're doing. The milestone.
Yeah, thank you so much, sir.
Thank you.
You cannot start the video because the host has stopped it. Karan. He's connecting to the audio.
नवाखालीचे
नमस्ते.
उदय सालुंके हिअर.
हो हो, कसे आहेत तुम्ही? ठीक आहे ना?
मजेत मजेत.
हो.
तुमच्या कॉन्स्टिट्युन्सी मधले सगळेच लोक चांगले असतात. I'm in that area, Nehru Chembur from 1972. So I know kind of work which you're doing there.
जी जी, थँक्यू व्हेरी मच.
Quite familiar.
आता तर मी अनुशक्ती नगर मधून आहे ना.
I know माहितीये मला. आता तुम्ही इकडून आहात माहिती, कारण मी युनियन पार्कला आहे गेले 15-20 वर्ष.
हा, म्हणजे शेजारीच आहे.
हो हो, मैत्री पार्कच्या समोरच तिथेच. आता सगळे तुम्ही मंडळी बिझी असाल बऱ्याच गोष्टींमध्ये.
हा, हे थोडासा पॅन्डेमिक मुळे.
टोपे साहेबांचं आता मी बघतो तरी आम्हाला वाटतं टोपे साहेब लवकर म्हातारे झाले होते एका वर्षात. खूप प्रेशर आहे ना. पण तुम्ही स्किल युनिव्हर्सिटीचं खूप छान झालं सर, खूप फास्ट झालं. म्हणजे सुवर्ण खरात मॅडम बरोबर माझं इंटरॅक्शन नेहमी असायचं आणि त्या टीम चांगलं काम केलं.
सर्व लोक समितीत होते ना ती. हो,
आम्ही होतो ना. मी होतो, डॉक्टर खोले होते, वेळुकर सर होते, आम्ही सगळेच. पण ते खरंच चांगलं झालं. दॅट वॉज रिअली गुड.
आता मुंबईलाच करायचं आहे.
हो 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 हो. युनिव्हर्सिटीमध्ये काहीतरी चाललंय प्लॅन ना आपलं पब्लिक स्किल युनिव्हर्सिटीमध्ये.
हो हो
हो हो.
आता सर्व लोक आले की नाही, व्हिडिओ चालू करणार की नाही? गांधी सब लोग जुट रहे.
जी सर, बाकी सब ज्वाइन हो रहे हैं.
अभी कौन कौन बाकी है?
सर अभी सोनिक मैम ज्वाइन हो रहे हैं एंड खुशवा सर ज्वाइन हो रहे हैं.
और अपने ये
रामास्वामी सर भी ज्वाइन हो रहे हैं सर.
होने वाले हैं.
जी जी सर, अभी बात हुई उनसे.
और तुम्हारे MIT
की टीम सर ऑनलाइन है.
ठीक है, डॉट्स शुरू करो.
Sujata ma'am, good evening.
Hello there.
And good evening.
Good evening. It's wonderful to finally reach this point.
Yes, yes.
Been a long journey to get here.
आपका ड्रीम जो लास्ट ईयर जैन में था, जैन 2020 में अपना MIT इंडिया इनिशिएटिव के साथ में ये हैकेथॉन करना है. Because of Corona, it got postponed, but happened.
Yes.
I'm so glad with Hiten, Suvarna ji, and entire team put the show very well. Really.
Yes, yes, absolutely. So the INOS team has worked very hard.
Yes,
and
yes.
There were several, discussions. Hiten kept on and on with them.
Yes,
But
yes.
finally, we have reached here. So yeah, very, very happy.
Yes.
And welcome to everyone. So we have a lot of people joined. Namaskar, sir. Lot of people have joined.
Yes. I was complimenting even Malik Saab, and because of आपके वजह से सुवर्णा जी and panel, तो स्किल यूनिवर्सिटी का जल्दी हो गया सब. So I was just मलिक साहब को मैं वही बता रहा था, ऐसा इतना फास्ट कभी मूव नहीं होता है, but it happened really. Hopefully it will take it to good heights.
Yes, absolutely. Both the team worked very hard. Suvarna and her team and the law and judiciary department team, they worked very hard to complete all the paperwork.
Very true, very true.
Right. So we will just wait few minutes. I think we are about to hit the 6 o'clock hour. I don't see the MIT team yet, Neil.
Ma'am, we'll just wait for 5 minutes more. Next is MIT, everyone's joining in.
हाँ, ठीक है, आप बताइएगा.
जी मैम.
We have almost 109 participants already. That's awesome.
That's nice.
हाँ, 100 के ऊपर लोग हैं अभी भी जो ज्वाइन कर गए हैं. 18 panelists and attendees have already signed in.
But आपके problem statements also are really good and
very relevant to what's going on.
Very relevant, very relevant.
And we have the ownership of the health department.
Yeah. That's really nice.
We'll just wait few minutes.
Yeah.
Hi Sandeep, welcome.
Yeah, hi. Thank you. Sorry, I was having problem with just the passcode.
No, that's fine.
Hello, Sandeep.
Good evening, ma'am. How are you?
I'm very well. Thank you so much. And thank you for all the support that you have given us, which has made this possible.
I'm glad that we have a great slate of participants.
Yes.
Very good.
Looking forward to the discussions. And I think what Uday and I were just talking about, last year we had planned this, we couldn't do it, but in the backdrop of the present, pandemic's form, I think it has become even more relevant. So yeah, hopefully I'm really keeping my fingers crossed something good comes out of this.
Yes.
And I think the problem statements are also very long, forward looking. So that's great.
Yeah.
So looking forward, and we are just waiting now. Yes, I can see Vanchita has joined. We are waiting for Tanya. And we'll get on.
Ma'am, Smita has just joined us from the MIT team. Hi, Smita.
Hi,
and Krish
nice
as
to
well.
see you guys.
Hi, Smita. Hi, Vanchita. Great to see you.
My light.
So Vanchita, just a quick question. Would Professor Zen Shu be joining us at any time during this weekend?
Ma'am, I think someone from the MIT team could better answer that.
Okay, please do.
I will find out.
That'll be really nice. It'll be wonderful if you can come anytime during the next, 48 hours and address the group. Maybe when we have reached the level of, shortlisting the teams and come and sort of give them a motivating session. That'll be really wonderful. Please tell him my special request for him.
Sure, ma'am. I will find out.
Thank you so much. Smita, should we start? It's 6:04.
I think like depending on how many participants should be here, maybe give it a couple more minutes, but if not, it seems like a good number, then it might be fine to just start.
Let's wait another 2-3 minutes. It's 157 people. Yeah, let's give it another few minutes.
Participants also need to learn to be on time, and that will be one of the first criteria.
Agreed. लेकिन बच्चे हैं. चल.
ठीक है.
ठीक है. Let's wait. It's the number is going up slowly. 158 हो गया. 159. The people are signing in. Let's give it a couple more minutes.
Yeah. Hi Sandeep, I don't know if we have interacted in a forum in V School also.
Yes, Dr. Sunke, nice to meet you.
Nice seeing your lot of ventures, good learning for all of us.
I think it's a good role models for other entrepreneurs, that the budding entrepreneurs. That's the thing that makes it most exciting for us.
True.
स्टार्ट करें हम लोग. सोनी मैडम स्टार्ट कीजिए.
जी सर बिल्कुल. अभी ऑलरेडी 170 लोग हो गए हैं. नील प्लीज स्टार्ट.
फिर 70 हो, हमको स्टार्ट करना है. टाइम किसी के लिए रुकता नहीं और हमें भी किसी के लिए रुकना नहीं चाहिए.
जी सर, बिल्कुल शुरू करेंगे सर. नील आप शुरू करें प्लीज. नील.
Ma'am, he called on and then he dropped off. He was on and then he's.
कोई बात नहीं. मिथुन आप.
Mithun, why don't you start?
और देवेंद्र, anybody please introduce करिए.
Sure, ma'am. I think Neil has come back.
हाँ चलिए. नील प्लीज शुरू करें.
Hey, ma'am. Good evening, ladies and gentlemen, boys and girls. I'm Neil Lalka, your host for the evening, and I'm happy to invite you all to the inaugural ceremony of the first ever Maharashtra Health Hackathon, M@. This hackathon is an initiative to promote innovative solutions for addressing the key challenges faced by the health department in the state of Maharashtra. This hackathon is presented to you jointly by the Maharashtra State Innovation Society, Department of Skill Development, Employment and Entrepreneurship, and the National Health Mission Maharashtra. Maharashtra State Innovation Society is the nodal agency for startups and innovation and works towards the objective of developing a vibrant startup ecosystem in the state of Maharashtra. This event has been sponsored by the Action COVID team, also known as ACT Grants. In March 2020, the Indian startup ecosystem founders and VCs came together to launch ACT, a 100 crore grant to power startups building and deploying solutions to combat COVID 2019. In a short span, ACT has powered the efforts of over 52 startups across 102 projects, impacting 49 million lives across 27 states of India. ACT has now expanded its mandate to cover 4 key areas: healthcare, education, environment, and women's participation in the workforce. Happy to inform the forum that ACT and Innovation Society have been working closely over the last 1 year to deploy innovative solutions across the state. Our knowledge partner for this hackathon is MIT Hacking Medicine, and our academic partner is V School, one of India's leading management training institutes. Our ecosystem partner is TIE Mumbai, one of the world's largest entrepreneurship platforms. Our incubation partners are Betic Lab, IIT Bombay, Mumbai University Ideas Incubator, Riddle Somaya, and WISE Incubator, SNDT Women's University. Without further ado, I would like to invite our first speaker for the evening, Mr. Sandeep Singhal, co-founder and managing director, Nexus Venture Partners, and spokesperson, ACT Maharashtra.
Thank you, Neil. Welcome everyone to the hackathon. I'm really looking forward to this event, and thank you, Madam Sonik and Mr. Malik for allowing us to support this initiative. We believe that this is a very important initiative for the state of Maharashtra, but more broadly for healthcare overall. One of the things that we have been very privileged to be part of is working very closely with the Innovation Society in bringing solutions to solve, for addressing the COVID situation that we have had to face, and then taking the example from Maharashtra to other states. So Maharashtra was one of the first states where we deployed remote ICU support. So working with companies to allow district hospitals and remote locations to provide ICU services, which was very helpful in terms of reducing mortality as well as helping patients discharge in time. The role that we saw going forward as ACT, our hopefully our initial goal at the start of the year was COVID had sort of reduced, and we felt that we could move to the next stage of addressing healthcare innovation and finding new opportunities for healthcare solutions. And there are multiple areas where we have issues. Clearly, maternal and child health is one big area. Tuberculosis is another big area. Cancer screening we see as another large issue. Diabetes in rural areas. We think of diabetes as an urban problem because of lifestyle issues, but it is also a dietary problem. And we also see reasonably high level of diabetes in rural areas, and that leads to complications in the future. And mental health is sort of, so those are clearly large problems to solve. And the way, as being part of a startup community, our approach has been to look at how we can deploy technology most effectively in solving these problems. So from the work that we did with the Innovation Society over the last year, we've actually seen a lot of interest from the Maharashtra state, from the health department, to try out different alternatives, particularly coming from young startups, to address some of these issues. We worked on areas of track and trace. We worked on areas of oxygenation, in testing. All of these were driven by startups, like what all the participants are looking to form over the next 48 hours. And the fact that the state health department has taken the leadership here in identifying the areas that are important to the state and the areas where there are clear needs, we feel is very important, because whatever you identify and solve in the context of Maharashtra state is obviously applicable all across India. So having Maharashtra as a dynamic state or take the lead in identifying solutions and partnering with young entrepreneurs to introduce them, we are very happy to support and look forward to the next 48 hours of intense sort of, getting together, working to find solutions, and just innovation. So looking forward to it, and welcome everyone. Neil, over to you.
Thank you, Sandeep, for your kind remarks. I would now like to invite Dr. Uday Salunke, Group Director, Principal Ellen Wellinger Institute of Management Development and Research, also known as V School. Dr. Salunke's passion for leadership, design thinking, and innovation has helped V School carve itself a niche in the space of management and education. Dr. Salunke has been a recipient of the prestigious Eisenhower Fellowship. Dr. Salunke, over to you.
Okay, thank you for kind introduction. Namaste, good evening. Honorable Minister Shri Nawab Malik ji, Department of Skill Development, Employment and Entrepreneurship. Honorable Minister of State Shri Sambura Desai, Department of Skill Development, Employment and Entrepreneurship. Srimati Sujata Saunik ma'am, Additional Chief Secretary, Department of Skill Development, Employment and Entrepreneurship. Dr. Ramaswamy ji, Commissioner of Health and MD, National Health Mission. Sri Dipendra Singh Kushwaha ji, CEO Maharashtra Innovation Society. Shri Sandeep Singhal ji, MD, Nexus Venture Partners and spokesperson Act Grants for Maharashtra. Dr. Suvarna Karat Madam, Joint Secretary for Skills. Hiten, an entire MS-INS team, MIT Hacking Medicine team, faculty, students, budding entrepreneurs, and the most important, the participants. I've been told the participants from 16 to 58. It's a wonderful range. So irrespective of kind of, that kind of age difference or maybe demographic difference or so. Mentors, juries, volunteers. But first of all, congratulations to Government of Maharashtra for Minister of Skill Development. It's wonderful. And I was sharing with ma'am before starting this program, it's Sweta Sonic ma'am. I said the dream which was seen by the department and her team about a year back, it's actually realized despite of challenges so much, in the outside market or so. But it's wonderful. And as Sandeep ji did mention, Maharashtra has shown a lot of initiative and dynamism in the skill space, innovation space, and the institutions like us would be very happy. And it's proud privilege for us to be with this hackathon as an academic partner. From our participants' point of view, I'm sure the backdrop, if you really take off overall, India has ample problems, like developing countries have ample problems, but wherever there are problems, wherever there are challenges, be it from population point of view or multiple kinds of divides, be it rich and poor divides or digital divide or climate change or GR, whatever you say. But all these problems or challenges gives us ample opportunities. When we look at developing countries, underdeveloped countries, that market is close to about 5 billion plus people. And the size point of view is about close to $30 trillion. So you can imagine at least some small pie also, if you pick up of that 5%, 10% of that kind of market, wherein you have huge opportunities. In the recent past, when we see Make in India, Startup India, NEP, are all kind of interventions to create the channel of ideas which can lead to innovation. And I'm glad all those initiatives of innovation-driven or startup, IP, IIC, and put us actually in a global map point of view from 81 to 48 in last 2015 to 2020, and which is in line with all those so-called good innovation-driven or innovation index-driven countries like Switzerland or Sweden, US, UK, be it on the east side or west side. So it is wonderful. On the other hand, probably you'd really find the increasing mobile penetration, digital technologies are making the impossible to possible, and which is really kind of, bolstering in terms of human imagination, creativity, ethics, and intuition, and taking us forward. Last year we've seen multiple unicorns. I believe it is about 12 unicorns. 2020 we've already seen about 10 unicorns. So you will really find this is showcasing all the time that how probably our startups, our entrepreneurial spirit is taking a lead for the next practices and not just mere as the best practices. And India, a hub for talent of individuals, and hackathon like this brings such pool of talent together. And I'm glad Maharashtra State Innovation Society, Skill Ministry have put in a lot of efforts to make this happen. And this is exactly coming at the time when the challenging times we are facing in the outside world, and particularly in the healthcare point of view. Now, these challenges, Sandeep has already illustrated the many challenges, and this is a superb opportunity. And the problem statements and themes are absolutely in sync with what really society is looking forward to. Whereas it comes to V School, we always actually talk about V is a new I. And I'm sure many of you must have realized and witnessed that our legitimate name is Wellington Institute of Management Development Research, but we brand equity point of view also made it as a V school, and not today, but in 2008, because we realized that me is not really going to make any kind of difference, but that we is really required. And all the participants, I'm sure you're all going through the hackathon process, be it starting from maybe defining, ideation, creation, iteration, prototyping, build and develop further on business plans. And hackathon is a wonderful opportunity for you to, come out with the new ideas and get to the executability point of view even forward. We have seen, actually, frankly, we have seen 2014, first time when we joined hands with the MIT Media Lab and with Professor Ramesh Raskar and his team, and maybe other event professors coming from MIT and Harvard, both the sides. And we did 5 days workshop. It was the first time. In fact, at that time, MHRD hackathon was also not there. But believe me, it was beautiful in terms of our own learning curve. And the entire campus of V School, we converted as if like it's a lab. And that was, I think, we felt that's the right thinking. Walls may be there for the classrooms from regulator point of view and all other aspects point of view, but we should not see walls as walls. It's maybe transparently we are connecting like a marketplace or so. And that gave us the first time the beginning. Later on with MIT India Initiative, MIT University, we did wonderful hackathons. Also with Tel Aviv University, we did with Swedish partners, which with multiple global partners also, which we work, that we got good opportunity to learn, even NASA Space Center point of view. So I think even though that overall format has changed, but technology has really enabled us to take it to a different league altogether. And my humble request to all the participants, the kind of skill set which you'll develop in this process, be it 16 or be it 58, we always need to be agile learner. That's what we always stop talking about it. First of all, very clearly, you will learn to be in diverse teams and leveraging strengths from each other. More the diversity, you will find better are the ideas and solutions. And it may lead to sometimes discomfort. It may lead to sometimes conflict, but that creative conflict is absolutely in the name of the game. Maybe always tell our own faculty and students that working through opposable minds is the name of the game. If you're in the comfort zone, you'll never learn. And also probably you'll find that empathy is absolutely core fabric at this particular juncture and all the time. So need to empathize with the stakeholders, prototyping. And prototyping is really very much essential. That fail early to rise early. That's the way we should really looking forward to. You will learn in this bargain also very high frustration tolerance. It may be like a donkey patience you will learn, but which is required. While pitching before other multiple stakeholders, you will learn how I can narrate my story. Because I think narrating that story, which is far more important, integrating from business point of view, the technology point of view, human values point of view, needs, design thinking point of view. I think that blend of multiple thought processes which will really take it forward, and that value creation for society, maybe be it from the product innovation process or experience point of view, would be a great, I'll say, contribution to society. And not only your learning would happen here, but post hackathon as well. I'm sure Maharashtra State Innovation Society Skill Ministry is going to provide you mentorship that will be useful. Post, in fact, pre-incubation efforts will be really respected and it will be good learning for you. Pitching to investors, some kind of, I'm sure cloud credit also will be there with you. And collaborating with MSINS will be helpful for all innovators. And from the patent point of view, startup point of view, our experience shows that when first time we did with, in fact, MIT Media Lab, first hackathon, immediately we got funding from Tata Trust to the tune of almost $100,000 those days in 2014. We brought together MIT researchers, us, our students, our innovators, and we launched RedX Lab. The RedX Lab led to business schools hardly do any kind of, because it's a 2 years MBA program. But still we could launch a couple of almost 3 patents in healthcare space. And purpose was high quality, low cost solutions that may be in skin, ear, or eye point of view. So these aspects are extremely important. And my submission to all the participants, this is one of the best, I'll say, platform and best opportunity. Be agile learner all the time. And V School Wellinger will be always there with the state government, MSINS as well as a platform. And that's why we are we. So please leverage us and let's be together to make this state, this society is a better place for us for tomorrow. Thank you very much for inviting us.
Thank you so much, Dr. Uday Salunke, for your kind remarks. I would now like to invite Shri Dipender Singh Kushwaha, Commissioner, Skill Development, Employment and Entrepreneurship, as well as the CEO of the Maharashtra State Innovation Society. In the past, Kushwaha sir has served as collector for the districts of Nashik and Mumbai suburbs, and has also been a part of the Maharashtra Housing and Area Development Board, MADA. Over to you, sir.
Thank you, Neil, and thank you, everyone. I welcome you all on behalf of Maharashtra State Innovation Society. The respected Honorable Minister Nawab Malik sir, respected Minister of State Sri Shambhuraj Desai sir, respected Ma'am ACS Ma'am Sujata Thonik Ma'am, and Uday Salunke sir, Singhal Sahab, and dignitaries and other participants of this hackathon. So first of all, I welcome you all for finding out time and being part of this platform. As all of us know, Maharashtra State Innovation Society was set up under the aegis of Department of Skill Development, Employment and the Entrepreneurship of Government of Maharashtra, is the nodal agency for the startup and innovation in Maharashtra. The objective of the Maharashtra State Innovation Society has been to create a vibrant ecosystem, startup ecosystem in the state, and work towards making Maharashtra an attractive destination for the startups. The way back in 2018, the Maharashtra State Innovation Society has also launched the Maharashtra Startup Week, which was a one of its kind platform for a startup to get an opportunity to pitch and compete for the paid pilot in collaboration with a relevant government department. Many successful winners have been completed their project in Maharashtra. The Innovation Society has completed so far 3 editions of this Startup Week over the last 3 years, and is working closely with 72 startups to deploy their solutions in the government sector. Many of them have already completed their successful project with the government of Maharashtra and now have become a good big company, and they are guiding the country or the world in these issues. In terms of business incubation, business incubation is the early stage enterprise, has been globally recognized as an important tool for economic development and job creation. The State Innovation Society is setting up 17 technology-based incubators in the state. Out of these, one is totally women-based incubators in Mumbai, in collaboration with the industry and the academia to foster the startup ecosystem and to enable the early age entrepreneurs to succeed in their pursuit. Beyond the Startup Week and the incubators, Maharashtra State Innovation Society has recently launched support scheme for the patent cost and the quality testing and certification cost. Startups incorporated in Maharashtra are eligible for the reimbursement of up to rupees 2 lakh for the domestic patent and the rupees 10 lakh for the international patent, and up to 2 lakh rupees for the quality testing and certification cost. Applications are being accepted on our website. The website is being circulated widely. We have given it wide publicity on our various platforms like social media platform and in the newspaper as well. So people can visit our website, which is www.nsins.in, and can apply for the benefit of the scheme. Today we are the part of Maharashtra Health Hackathon with the help of Health Department official, especially Ramaswamy sir. He is the Commissioner Health. He is quite occupied today, even though he find out time, and his team is fully working with us to complete or get this successfully conducted, this Maharashtra State Health Hackathon. So Maharashtra Health Hackathon is the first of its kind initiative to promote innovative solutions for addressing the key healthcare related challenges faced by the government in the state of Maharashtra. The key objective is to make Maharashtra Health Hackathon a collaborative platform for the innovators, academia, investors, industry, and the state government for building an innovation-oriented mindset for the innovators to solve the state's most pressing problem by developing the idea into a product. As all of us know, we are facing a serious problem of corona pandemic, and we are finding various solution through various startups. So I'm sure this health hackathon will definitely help us getting or finding the best solution, and that will lead to the world and to the country. This hackathon is being organized in partnership with eminent partners such as MIT Hacking Medicines, ACT, ACT Grants, Wellinger School of Management, TIE Mumbai, and Betic IIT Mumbai. To ensure inclusivity and to invite young students and professionals from various backgrounds like medicine, engineering, design, any person over the age of 30 could apply for this hackathon. Shortlisted applicants, 300 shortlist applicants will be working on the problem statement over the course of this weekend. Shortlisted ideas and solutions shall be eligible for mentorship for developing a proof of concept, pre-incubation offers, opportunities to pitch to investors, and cloud credit of up to $5,000. The Maharashtra Health Hackathon shall have 4 tracks. The track A will be for vaccination and immunization. The track B will be for affordable diagnostic tools, and the track C will be for responsive emergency services, and the track D is for medical devices and improving neonatal care. Later today evening, the problem statement shall be released. Tomorrow morning, means Saturday morning, the team shall be formed, followed by a hacking and mentoring sessions. The day shall end with the practice pitching sessions. On Sunday, the final pitch videos shall have to be uploaded and reviewed by the eminent jury, followed by an award ceremony. In the near future, the Innovation Society shall also be announcing an Maharashtra Deep Tech Innovation Fund, which will support various innovators in the deep technology and applied research sector shall be supported. The Innovation Society shall also be launching a Maharashtra Virtual Incubation Center, which will be a virtual platform that will ensure that a startup anywhere in Maharashtra will have access to the quality vendors of the cost-effective price. So there are various initiatives taken by the Innovation Society to help the startups to create an environment, a positive environment or ecosystem for the startup and to the innovators. I'm thankful to all the participants and all the institutes who have been continuously helping us in our growth and the development of the Maharashtra. So I'm again with these words, I stop here, and I'm thankful to all of you for your valuable time. Thank you. Thanks again. Over to you, Nick.
Thank you so much, sir, for your remarks. I would now like to invite Dr. Ramaswamy N, Director, National Health Mission, Maharashtra. Dr. Ramaswamy has earlier served as CEO, Maharashtra Maritime Board, and as the Municipal Commissioner of Navi Mumbai. Over to you, sir.
Thank you. Good evening, all. Honorable Minister Nawab Malik, sir. Honorable Minister Sambhurajay Desai, sir. Honorable ACS Sujata Sonik, madam. And my colleague Dipendra, Professor Salange, all the participants of this hackathon. First of all, I thank you for inviting me for this hackathon, because we are the user department. We are going to be the most beneficiary of all these efforts that is being taken by Maharashtra Innovation Society. I thank ma'am and Dipendra for taking this topic for the first time in the country. And most relevant topics have been taken up in this. And as you see, but for this corona issue, otherwise the current problem is mostly of non-communicable diseases. And in Maharashtra, if you see, over the years, we have improved on lot many indicators of health across the state when you compare. But as far as the topics which have been selected by Honorable Madam is really appreciable, in the sense that in case, for example, in case of infant mortality or under 5 mortality, we have achieved a particular level. We are much ahead of the national average, but we are struggling to cross that particular limit, and we are static for over last few years. For example, this fetal weight detection during 38 weeks of gestation, it's very important. And again, in neonatal mortality, things for prevention of hypothermia, hypoglycemia, infection during sick neonatal transport. And one more major issue Maharashtra is facing is the anemia at all age groups. In the recent survey also, national survey also, it is one of the major factor. And we have a lot of difficult areas, tribal areas, geographically difficult areas, hillocks, where the communication is still an issue. Though our coverage of communication is much better, still we need a lot of innovations in that. And the not the least is the vaccination. Though we are having good vaccination coverage, it is not uniform across the districts. And we have so many issues to discuss, and we need so many innovative solutions for all these. So we may have resources, but we need innovative solutions. So this is a better good opportunity, and to bring in all the fresh minds and ideas into finding some solutions for all these pressing issues. And as we discussed with ma'am also, we have so many such topics. There are 27 odd national programs going on in various programs, whether it is thalassemia or all these kind of blood-related issues, non-communicable diseases. There are so many topics. We need multiple hackathons for health department. I request ma'am to arrange this on a periodical interval, and we will be more than happy. Just we are hoping that this pandemic peak, second wave of that pandemic gets over as early as possible. And so whatever ideas which comes up, which is workable, definitely the department will take forward. I assure ma'am and the honorable ministers. And our team is there, and a lot of fresh minds are participating. I hope more than 300 participants are expected in this hackathon. And so whatever best solution we will come up at the end of this hackathon, definitely I will take it personally and take forward to have a uniform and better solution across the state, and especially for the remote areas and difficult districts. And as the time is limited, I will stop with this. But I thank on behalf of Commissionerate and the Department of Health, on the Maharashtra Health Society, Honorable Ma'am, Honorable Ministers for organizing such a hackathon for the first time in the health sector. And it is going to be highly beneficial to the state. And once again, I thank all the organizers, Deependra, everyone, and we are looking forward for many innovative solutions in the topics which have been taken up. Thank you so much.
Thank you so much, sir, for taking out time when the NHM is working tirelessly to control the ongoing pandemic in the state. May I now invite Srimati Sujata Sonik ji, Additional Chief Secretary, General Administration Department Services and the Skill Development, Employment and Entrepreneurship Department, Maharashtra. In the past, Sonik ma'am has served as Secretary for the Finance and the Public Health Departments and the National Disaster Management Authority, NDMA. Sonik ma'am is a Takemi Fellow at the Harvard T.H. Chan School of Public Health. Over to you, Sonik ma'am.
Thank you so much, Neil. Respected Minister Nawab Malik ji. Unfortunately, today our MOS Shambhu Rajeji is not able to join in person, but he has sent his best wishes for the program. My colleagues from within the government, both Mr. Ramaswamy and Dipender, the young team at INOS who has made this possible, and very warm greetings to all the participants, the MIT team who has joined us from Boston, and all our mentors and guides, and the young team and esteemed guests. Warm greetings to you from Mumbai, India. And I'm very happy that the first edition of the hackathon has been launched today under the aegis of the Maharashtra Innovation Society. It is well known that early incubation and support provided to teams who are developing ideas can prove to be a boon. And Maharashtra is one of the leading states in the country where the ecosystem to support startups is very healthy. And we are hoping that as part of the outcomes of this hackathon, we can bring some ideas from design table to actually product in the market. I would also like to personally acknowledge the support and work being done under the ACT platform, which is a conglomeration of various industry partners. They have been steadfast in their support to us over the last 1 year. Sandeep ji, and I would also like to acknowledge the presence and support of Uday Salunke ji from the Velinkar Institute, and we look forward to our continued partnership in the future. I would like to start from this point that India is supposed to be heading towards a youth dividend. This decade is a very important decade for us because the average age of an Indian in the country is going to be around 26 to 27 years. And we need to already think and plan avenues where we can tap this youth dividend. As earlier said, the age group for this hackathon is very diverse, but that's India. India is diverse. And it's very hard to predict things. And I'm actually very hopeful that this mixed group of participants will actually provide us some new ideas. Now, as already highlighted by my colleague Dipinder, the Innovation Society is running several important programs that provide support to early age startups. And we are hoping that the hackathon will provide the missing link. So far we have been giving support to startups who have already formed. Now we are going a little bit back and we are trying to give support to startups who would like to form. They have some idea, and this ideation we can take it forward. And as also pointed out that the first ever entrepreneurship cell is being created in the first Women's University of Maharashtra, the SNDT Women's University, that is being created there, and it is going to be started very soon. I acknowledge the ownership and support provided to us by the Public Health Department, which is trying very hard to provide a solid COVID response. In fact, Maharashtra's situation today, I must appreciate, is much better than several other states. There is a proper response system in place. There is a standard operating procedure. Our cases are steadfastly falling. Mortality is very low, next to negligible, and the 88% of our caseload is asymptomatic. So the state is doing its best to protect its citizens. And therefore, in this backdrop, to come with an hackathon on public health is something that is really very timely. So the only major point that I would like to mention here, as part of this response under the ACT platform, some of these startups who have provided us valuable support is one called Intugene, which is providing us last mile connectivity for cold chain maintenance of vaccinations, for vaccine maintenance. And there's another one which has come into the market with a small ECG. So people who are otherwise compromised and cannot leave their homes can get an ECG report at home. There is, of course, Dozy, and there are medicine startups also which have come into the market. And all of them have provided support in almost 14 districts of the total 35 districts of the state. This time, we hope that we shall be able to expand to the entire state. So with these remarks, I once again welcome everybody. I hope that the next couple of days will be very intense in discussion and brainstorming, and we can bring some ideas forward. I think this is a very, very timely exercise. I thank all our partners and supporters who have helped us to reach this stage. Thank you so much once again. Neil?
Thank you so much, Sonic ma'am, for your remarks. Without further ado, I would now like to invite our chief guest for the evening, Shri Nawab Malik ji, Honorable Minister, Skill Development, Employment and Entrepreneurship Department, Government of Maharashtra. We are fortunate to have such a dynamic and a visionary leader as a minister for our department. Under his guidance, the government has been able to foster the startup and the innovation ecosystem in Maharashtra. Over to you, Minister, sir.
Thank you, Nick. It's my pleasure to be a part of this medical hackathon organized by Maharashtra Innovation Society with partnership MIT Boston, and it is supported by ACT. This institution has been funded the hackathon, which is organized by us. Definitely, today many of the students are joining. They are very much eager that they are getting some kind of a challenge to resolve the challenge they are having before them by this hackathon. Definitely, this is medical health hackathon, and we have given some challenges which we are facing in the state of Maharashtra, whether it is related to anemia, whether it is related to underweight child during the birth, whether it is related to MDR, tubercle losses. So these all challenges we are going to face before you. And definitely the new age people, the new younger generation, definitely they must have some new ideas with their mind. This more than 300 people will be selected for this. Definitely for this 5 problem we are facing, definitely they will pitch some kind of idea. And out of that, some of them will be selected by the institution. They will be supported by the institution. As Mr. Kushwaha and our secretary Shaunik ma'am has said, a lot of thing has been done by the Innovation Society. We had started many of the program. We have incubation centers. We are funding 17 incubation centers. We had started some sponsorship program for their patent testing and many kind of things we had started. In future also we are going to start some new our schemes for the new startups in the state of Maharashtra, especially those who are working. We must have a funding kind of a thing. What we observe from the interacting with the startup, some of the startup they are very much possessive. They think this is my baby, and I will grow with this my baby, and it take more time to grow. So some kind of a mindset have to be set up with the startup, the inventor. Definitely they invent, they bring some ideas before the society, before us, or before any of the platform. But they require some kind of a funding. Any invention is very much helpful to the society until and unless it goes to public. Until and unless the invention goes to masses, cannot tell, we cannot say this is very much successful invention. So this kind of a mindset also to be set up with the this all startup, those who are working, and we very much we will welcome the ideas which will be selected by this hackathon. Ramaswamy is there, G is there, he is head of the commissioner of the National Health Mission Program. So one thing I have to say, Ramaswamy ji, today we are pitching problem of MDR TB. Some of the people has invented something. They are always pitching their idea, and we can adopt it, and we have that kind of a solution. Also, we are pitching the same problem along with new inventor. Some new ideas can also be there to resolve the issue what we are facing in the state of Maharashtra. But in future, we have to have some kind of a policy that we are giving a lot of order, but we cannot give order directly to the startups. Only some kind of ideas we are pitching that 15 lakh or rupees order will be given to the this startup will not resolve the issue, resolve their problem with giving 15 lakh rupees order. There should be some policy that without tender, we can give this, if anybody give solution to the problem, definitely we can give them order to support their invention, to order to support their invention to get benefited by the mass in the society. So definitely in future, Sonic ma'am is there, Kushwaji is there, Mithun is there, entire INOX team is there, and other guests, those who are participated in this hackathon, Mr. Sandeep Singhal and Uday Salunkeji. We must assure you that in future also we'll bring some more good policies for the startup in the state of Maharashtra, We will create more incubation center, and we will support the startup in the state of Maharashtra. What is the responsibility of the department? Definitely, we will go ahead along with new ideas. Today, I must congratulate everybody, those who are participating in the hackathon. Definitely 300 or 500 people are there. Shortlisting will be there. After that, definitely some of the people will be selected to resolve the issues pitched before you. But don't be nervous. It is not the today or 2 3 days. This is the only the opportunity you are having. Definitely this time, if you are not getting any opportunity, you have to be continue with your ideas. You have to be continue with your thinking abilities. You have to be very much positive that my idea, some more kind of a new thing should be add on into it. But one day definitely you will be succeed. Your idea will be succeed, and you will be a successful innovator. Definitely, my best wishes are with you, everybody. Thank you very much.
Thank you so much, Minister Sir, for taking our time today. I'm sure all the innovators attending this forum found your remarks very, very encouraging. Before we proceed to the final vote of thanks leg of the ceremony, I would like to invite all dignitaries to switch on their video so that we can take a quick screenshot. Thank you so much, everyone. I would now like to invite Mithun John, Joint CEO, Maharashtra State Innovation Society, for the final vote of thanks for today.
Good evening, everybody. Honorable Minister Sri Nawab Malik, sir, SDED, senior dignitaries from the government of Maharashtra, Sri Uday Salunke ji from Melinkar, and Mr. Sandeep Singhal from ACT, and fellow participants of the hackathon. It's a great event for us that we are flagging off today with the Maharashtra Healthcare Hackathon. I'm sure it's going to be a great eventful next couple of days for you. We have the 4 problem statements that have been identified in partnership or with insights from the health department. I'm sure will be very useful for you. We have put in place a great set of mentors to guide you over the course of the next couple of days, helping you tinker with the ideas that you're going to work on. And like the Honorable Minister just said, during the course, we really hope you enjoy the course of building or working on or brainstorming the ideas that you may have. And for the ones that do come out of this successfully, there are other platforms that we have made available. Neil already mentioned to you about the cloud credits that we have. But apart from that, there would be avenues for you that would be created through our incubation centers to work further on your products and build up your ideas. And Sonic ma'am did mention to you about the startup week, where the idea is to have products that are at an MVP stage to pilot with the state government. We do hope sincerely that some of you would pursue the projects that you're working on and in due course be a part of the startup week and go beyond that as well. And on behalf of the Maharashtra State Innovation Society and the SDED department, I would like to wish each one of the participants all the best and have a next great couple of days going forward. Thank you.
Thank you.
Thank you, Mithun, for summarizing up the various sessions we had so far. Thank you so much to all the speakers and the dignitaries for taking out time for us today. We'll now invite the MIT team to brief us about the schedule for the weekend and give some more details to the participants who are attending this forum.
Thank you.
Hello, everyone. My name is Smita. I'm from the MIT Hacking Medicine team. I'm also here with Krish, who's helping to co-lead this. And I just kind of want to walk through a quick presentation about what to expect this weekend and how to approach the problems this weekend. So I will share screen and quickly go through this PowerPoint, and hopefully it's helpful. Oh, sorry, my thing is being set. Okay. Can you guys see this? Okay, yeah, cool.
Yes,
okay,
we can see it. Yeah.
So we are MIT Hacking Medicine. We're going to be helping to run a lot of the events this weekend, and are super excited for you guys to start. So before we get started, let's just talk about what hacking is. It's especially at MIT, you have the vision of someone who's coding on a laptop and trying to gain unauthorized access to something. But in reality, what hacking is meant to us is a creative application of ingenuity. So at MIT, this often looks like all these hacks that people will put up on different parts of the campus where they plan out and figure out how to use their skills in a fun and creative way. Oh, sorry, I think it needs to go to the next one. So what is the difference between a hackathon and a health hackathon? Health hackathons are kind of like a hack and a marathon all at once. So this weekend is going to be packed with so many events, and you're going to be working all the time, but you're going to love it. It's a marathon, and you're going to come up with some great solutions. Part of what makes the hackathon so important is that there's teamwork involved, it's innovative, and it's also very intense. However, you're going to meet so many people and really work on things that you care about. But health hackathons are not like other hackathons. There's no need to code like a lot of the CS hackathons that you'd see, the IT hackathons. They tend to have teams that are more interdisciplinary, and they have problem-centered work that focus on real user needs. So we start with the problem and the user. And part of your final pitch is that you need to help assess feasibility and business. So basically the process you're going to go through is you're going to identify a problem with your team. This is going to happen in the problem pitching session that's coming next. Then you're going to work with this team to break it down, understand really what the problem is, who is affected by it, why it happens, then brainstorm some ideas, and then continue iterating on it. And you'll be doing this the whole weekend until you get something that you're satisfied with as a final pitch. So let's show an example. One of the most famous examples that have come out of MIT Hacking Medicine is PillPack. So first, they started off with identifying the problem. They knew that 34 million people had issues keeping track of multiple prescriptions, and that 50% of people took the wrong prescription or were taking their prescriptions incorrectly. They realized that the amount of money lost in this was close to $100 billion, and that the amount of money spent on readmitting people because they were taking the wrong prescription was $700,000. So they realized that there was a very big need for something that could help you differentiate your prescriptions and allow you to take the right dosage. So they found that patients want their symptoms to be under control, but they often have to prioritize work and family over managing the many different medications they might have to take, which is why a lot of people end up taking the wrong amount. So then they broke it down further. They thought about their stakeholders. What do they need? What do they want? And what are they feeling? So they found that one of their major stakeholders were the patients, and they wanted better tooling to manage health. They were also frustrated and busy with their work life and not being able to manage this. For the family and caregivers, they were worried, and clinicians were annoyed. Pharmacies were losing money and trying to resupply prescriptions, and health insurance companies were concerned about the cost due to this. And then they found that the health system wants to avoid readmissions. So based on this, they were able to figure out the needs. They found that the patients need better tooling and that the health insurance companies need to decrease cost. So then they built up the solution. So they went through this exercise and they tried to understand what really their problem and their goal was. So their goal was to improve managing multiple medications. They wanted to improve the quality of care and pharmacy experience and the access to pharmacists and med. They also wanted to address the frequency and rate of medication taken on time and the right dose. They narrowed down their target customer to 20 to 40 people in their 20 to 40s taking multiple medications who suffer from chronic conditions. And they knew that they could improve the experience by taking care of the entire multiple medication experience. So today, they solve this by going to retail pharmacies, but the problem is that the experience really sucks. It's really not fun. So they wanted to attack management of multiple medications for 20 to 40-year-olds, people with chronic conditions, and into tech. They would want to be the early adopters because they are very busy and don't want major changes to their lifestyle. So then they thought of their solution, how to make it better. And they came up with this very innovative method of packaging medications based on when they needed to be taken and what needs to be taken when. So basically, a customer who wants to use PillPack will submit all their medications, and then it'll be packaged in individual packets that then they can take at specific times that have large labels that explain when they should take it, and will have everything that they would need to take in one place. So it's very easy for them to comply to what they need medically. PillPack was started as an MIT Hacking Medicine project, but continued past that and actually was acquired by Amazon for a multi-billion-dollar deal. So does this process really work? Over our 10 years in MIT Hacking Medicine, there have been 40 companies that have come out of this and $150 million in funding. There have been a lot of incubation offers, and there have been real patients that have been affected by these solutions through real clinical trials. So what you're going to be seeing this weekend is that you're going to be problem pitching and then mixing to find teams who have similar interests. Later today, you're going to be hacking. You're going to be getting feedback from our team and mentors, and then you'll iterate on your solution and present. So here you're going to be, right after this, you're going to be mixing, like I said. Then you're going to be hacking, which is going to be a lot of brainstorming on what the problem is and narrowing it down. Feedback will require us to check in with you guys through Slack. And then we will always be available for you guys to iterate the solution and ultimately present your final pitch. So just before we get started, here's a couple things that you should do and you shouldn't do. So as you're going into your tracks and you're going to start pitching ideas, you want to make sure that you're open to crazy ideas and that you leave job titles at the door. A lot of you guys come from very different backgrounds, and every single one of you have a lot to contribute, as well as you should be focusing on making diverse teams because those are the teams that we see are the most successful. Also make sure you're reaching out for help when you need it. And if you realize that your problem's not working, fail fast, try something new and pivot. Focus your problem. Don't just start with something general. Really try to understand who it's affecting and why it exists, and then build something, whether it be a business plan or like a mock-up demo of an app or a platform. That will be your final presentation. Now, things that you shouldn't worry about right now. Don't worry about patenting. This is not the forum for that. Don't discuss ownership. That should be a discussion that happens later if you continue doing this. And don't develop too broad of a solution. You should really find something that's specific to what the market needs. Don't be negative. Everyone's idea is a good idea. And don't be shy. Your ideas matter at this place. And don't just be the only one talking. So only talk, take action, try things out. So the way that problem pitching is going to work is that you will have a form that the track leads will send out to you, and you can sign up with a little blurb about what you want to pitch about. You will then be unmuted and can give a 30-second pitch, and participants will have access to these responses so that they can contact you later when we mingle and try to create the teams. So when you're doing problem pitching, some things to keep in mind. You want to make sure that your problem pitch is specific. You want to sometimes tell a story. Those are the most effective ways to do it. So for example, a great problem pitch would be, my father is blind and can't tell apart his meds because all of his pill bottles are smooth and similar in size and shape. As a result, he is dependent on me and another family member sorting his medication into containers marked with Braille every time he gets a refill. This says a clear need. It shows who the customer or user might be and how you can tackle a very specific problem. Something that wouldn't be a problem pitch is, I want to build an app that analyzes mood and vital sign data. It's super broad. You're focusing on the solution first, and it's not clear what problem you're trying to tackle. So as you're coming up with problems that you want to address, just make sure to keep this in mind. So as I mentioned, right after this, we're going to go into problem pitching. You guys are going to get some problems framed from some of our guests at WeSchool, and you'll join the Zoom. And if you have a problem that you want to pitch or something that you've seen in the healthcare field that relates to the track, you can add yourself to the queue by submitting the form that we'll send out. And just remember to take notes on the pitches that you're interested in and the pitch number. We'll send out something where it's easy for you to find these people, but it's also helpful if you have your own notes. And then you can look for these people during Mingle. Mingle will happen on Slack. So problem pitching in general will be 30 seconds. Make sure you're specific and make sure you're not talking about solutions. You'll get a pitch number and make sure you take notes on the pitch numbers you want to follow up with. So yeah, now it's the time to pitch. Remember the hack do's and don'ts, and I'm super excited to kick off for this weekend. Thank you so much.
Thank you so much, Pita. Such an interesting presentation you made. I will now request all the participants to join the respective links for discussing the problem statements as per your tracks A, B, C, and D. I would request everyone to come on the Slack platform where the links have been put up.